Hey everybody, this is Dr. Vince from FTR in Joliet. Today I'm going to cover a single test that we will use in physical therapy in order to diagnose or classify a vestibular dysfunction. And this test is called the Fakuda stepping test. This test should again be performed under the supervision of a physical therapist or with your physician. What will happen is you'll do this test with your eyes closed. I'm going to run through the test today on camera. I'm not sure how it's going to turn out. Okay, so if I look like I'm deviating one way or another, I'm probably going to be surprised because I don't think I have a problem, but my wife would tell you otherwise. So what we're going to do is you'll close your eyes, you'll have your hands forward, palms up, and you're going to march in place. At least I think I'm going to stay in place. And you're going to march for 50 steps or about a minute. And so we like to do a minute, even though it's not like that in the research. In the research, it's 50 steps. But a minute makes it a lot easier as I'm trying to guard the patient, to keep the patient from falling and staying close to the patient. This is typically done with patients who are at a higher risk for falling. So when this is done in the clinic, I am really close to the patient. It needs to be done in a quiet room, because if I can hear something, let's just say I have sound coming from this direction. If I turn my head like that, I know I must have turned because the sound went from my left to behind me. Here it's to my left, here it's to my front. So I know I must have turned. So you have to be in a quiet room when you're doing this test. So again, I'll go through and do the test. I'll count to 50. Arms forward, eyes closed. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 60. All right, that was a perfect test. Thank you very much. But what we'll see with some patients who have a vestibular dysfunction is when they're doing this test, they'll actually start taking off. and that's an indication that they are unaware of their surroundings. When the patients start walking forward, they're highly dependent on their visual system, their eyes, to tell them where they're at in space. For instance, if I start marching towards the camera, I can see I'm getting closer to the camera, obviously. And therefore, I can use my eyes to monitor my balance. If my eyes are closed, I may not be able to tell that I'm going forward. The other thing that we see, and what makes this a positive test, is when the patients start rotating. And they rotate more than the 30 degrees. Okay, I've actually had one patient during this test, not too long ago, who would do the test, and it looked like this. And he could not tell that he was moving. When he opened his eyes, and that's like the best part, right? Is when patients open their eyes after the test and they've moved and they can't tell they moved, they are completely shocked because they don't know where they're at. And that's what happens if the vestibular system is dysfunctional. You have a harder time telling where your body is at in space because the vestibular system, this little organ that sits behind your eye, sends input to your brain to tell you where you're at. So again, this is one common test that you'll see in a physical therapy clinic if you're being seen by a physical therapist who is trained in treating vestibular dysfunctions. If you have balance problems or you're feeling dizzy, please call us at FTR in Joliet. This exercise, again, this test should only be done in the presence of a physical therapist or a physician. Thanks for watching.